Assalamu alaikum. Hello everybody, it's Insila Shafat and I welcome you back to my channel. Hope you're all doing well. Today we are going to discuss the next topic of special investigations in X-ray, that will be barium male follow through. As we have already discussed about barium swallow and barium male, and we know in barium swallow we can visualize the esophagus, means food pipe, with the help of X-rays and contrast media barium, and in barium male we can visualize the stomach and the duodenum, which is the part of small intestines. Now when we talk about barium male follow through, it's actually a technique that's particularly designed to obtain high resolution images of the small bowel with the help of X-rays and contrast media barium sulfate, which is given orally to the patient. Now, as we know that in barium male, we have studied that we visualize stomach and small bowel, but only the one part of the small bowel, that was duodenum. Now, when we talk about barium male follow through, it's different from barium male. As in barium male follow through, we can visualize small bowel completely, means fully. So all the parts of the small bowel are visualized in this examination, and the parts of small bowel are duodenum, jejunum and ileum. This examination is a single contrast study because only one contrast is being given to a patient, that is positive contrast barium sulfate orally. So we can either give barium or we can give water soluble contrast, because if we are concerned about a small bowel leak, that time we can use water soluble contrast to the patient given orally. Now let's talk about the indications of barium male follow through, means why this investigation or why this examination is done. So the first indication is structures, that is the abnormal narrowing of the small bowel passage. Next one is the abnormal motility, that's the abnormal muscle and nerve contraction that can cause lack of motion in gastrointestinal tract. Next is the abdominal pain and diarrhea. Next is the small bowel obstruction, means blockage in the small bowel. Next is Crohn's disease, that is the inflammation disease where small bowel is being inflamed and that can affect the lining of the digestive tract. Next is nasogastric tube, means where we can insert the tube, that's the nasogastric, or it can be the endotracheal tube. So to examine whether it's properly inserted or not, that time also we can follow this investigation to check out this tube insertions. Next is malabsorption, means where there is a prevention of absorption of nutrients through small bowel. Next is anemia. It's a condition in which blood does not have enough healthy red blood cells. Next is gastrointestinal bleeding, and the last one is the abdominal mass. Now the contraindication of this examination, means when this examination cannot be performed. So the first is the chronic obstruction, means when in patient there is the complete or partial blockage of the bowel, that time this investigation cannot be done. Next is the suspected perforation, means hole present in the small bowel. Next is the paralytic illness, means when there is the obstruction of the intestines due to the paralysis of the intestinal muscles. There are some preparations that must be done by the patient before going through this procedure. So first preparation is that patient is said to take strong laxatives, means they are the medicines, and mostly laxatives we prefer Dulcolax laxative, that is given 2 days prior to the examination, and this medicine helps in easing the passage of fully formed fecal matter from the rectum. Next preparation is low roughage, high fluid intake diet is being taken by the patient 48 hours prior to the examination. Next preparation is no food fluid should be taken for 12 hours before investigation. It means patient should be on fasting 12 hours before the investigation. Last one is antispasmodics or any tranquilizers medicines are being stopped 24 to 48 hours prior to the examination. Here now the technique that's important, it means how the procedure is being done. So there are multiple different techniques that can be done to perform this barium male follow through. We will discuss one of the conventional approach. As we know that a patient starts fasting at midnight, so make sure that the study is being scheduled for the next morning. Firstly, we need to give single contrast to the patient so that upper gastrointestinal tract is being performed, means where we can visualize the upper gastrointestinal tract, which includes esophagus, means food pipe and stomach. So after this, we give the patient additional drinks, 1 to 2 cups of contrast barium sulfate, and he needs to wait outside so that contrast flows from the stomach to the small intestines. So it may take some time from contrast to flow or move from stomach into the small intestines. Approximately 15 to 30 minutes are taken. So after 15 to 30 minutes, we will take the spot radiography of the abdomen. We can evaluate the patient with fluoroscopy so to check the contrast when it reaches to the terminal ileum and enters the ascending column. So to take the next spot radiography of the abdomen where we can evaluate the terminal ileum and ascending column. So after next 15 to 30 minutes, we will take the next spot radiography. Now the films being taken in this technique. So there are 3 films that are being taken in this technique. First film, and the positioning of this film is right side down dependent, means patient is being kept right side down. So this is done to aid gastric emptying. Next film is where the patient is being kept in a prone position, and this is done to separate bowel loops. Third one is where the patient's positioning is right side up. It is used to visualize the IC junction. Here are some radiographs that are being taken through this technique, barium meal follow through. You can check out the image here where we can visualize the small bowel. Have a look on this radiograph and you can check out the duodenum here. Here is the ileum, here is the jejunum. Next radiograph is showing at the top duodenum having its parts. First part at the bulb, second part, third part and the fourth part. Down this image is the next radiograph where showing the duodenum, jejunum and the ileum. So this is all about today's topic. Thank you for watching. Take care.